Why do my patients come to me for fillers? When I'm injecting fillers, there are two things that my patients are really concerned about. One, of course, they want safety. They don't want any complications. And two, they want everything to look natural. And of course, they want results, but they don't want to be overdone. This aligns perfectly with my philosophy because the last thing I want is any complications. I'm shooting for zero complications when I inject fillers. And I know people are concerned about scary complications like skin necrosis, muscular compromise, and even vision loss. And these are things that are catastrophic if they occur. So the best way to address these complications is to avoid them in the first place. And of course, nothing is 100%, but the techniques that I use make the risk of these complications happening much, much less than they would if we inject the way that everyone else is doing. So I don't inject fillers with a needle blindly under the skin because the anatomy is different for every person. Now we know where certain vessels lie in the body, so we can generally avoid them by knowing the anatomy, but there are variations. And if you have an anomaly, which means you have an artery that's a little bit different in your face than it is in somebody else's, then even injecting in areas that are generally considered safe could lead to a complication. So, how do we avoid these complications? Well, we do it by avoiding the planes where these vessels exist. So if I'm injecting deep, I will use the lift technique, and this is a technique that was developed by Dr. Jan Trickel, where we inject the filler deep on the bone, and we're actually injecting it under the periosteum, which is a covering that covers the bone. So there's two reasons for doing that. One, there are no blood vessels down there. If you're going directly on the bone and you're under the periosteum, then that is a place that's considered avascular. There's no blood vessels there. So the chances of injecting into a blood vessel is minimal if you're injecting on the bone. The other reason that I like to do that is because it's under the periosteum, it's not going to move. It's not going to migrate. Because when we inject fillers, we're concerned about migration, which means the fillers will move to somewhere else other than where I injected it. So traditionally, when fillers are injected in the subdermal area, which means just under the skin, you could get a nice result. But over time, the fillers will move, and that's called migration. We used to think that hyaluronic acid fillers dissolve by themselves over time. This came about because when we first started injecting areas like the lip, the effects would last about 6 months, and then you would have to do it again because the effects will be gone. Now we know that the fillers don't actually dissolve away by themselves. They'll last for years and years. And what actually happens is that they just move away. So if you inject into an area like the lips where there's a lot of movement, then the fillers will kind of dissipate away from the lips. And where do they go? That's the problem. If you keep doing it over time, the fillers are going to move away and accumulate, and gravity is going to pull it down. So it's going to create heavier lower face, which is exactly what we don't want. So I stopped doing it. I know most people still inject directly into the lips and under the skin, but because of the migration, I just find that one, this is not economically desirable because you're going to have to pay for a new filler job every 6 months in order to keep up with it. And also the long-term effect is that the fillers will accumulate and then you'll start to look unnatural. And that's why celebrities who can afford to get fillers regularly over time will start to look abnormal, bizarre. So that's why now we're finding a trend where a lot of celebrities are getting the fillers dissolved out of their faces with an enzyme called hyaluronidase, and so that they can have a fresh start. The other way that I like to inject to prevent migration and prevent um, abnormal outcomes, and also to avoid vascular occlusion is to use the hyperdilute technique. And this is where I really dilute out the filler. So make it very thin so that I can inject it with a very, very tiny, what we call nano needles. And these are real tiny needles that go right under the skin. And when we do it this way, we're injecting above where any major blood vessels are. So it's so superficial that if you don't dilute it properly, you can actually see welts on the skin because you can see the filler. And that's why I like to hyper dilute it, which means you make it very thin and inject it very superficially. And what I like to do is use the tiny little nano needles and inject the filler right into those little fine lines, like those little smoker's lines that form above the lips, the marionette lines that make you look like a puppet, and also the nasolabial folds. And this technique is great because it's a little counterintuitive. You think that if you inject superficially, it won't give you the effect that you want, but it actually gives you a better effect with less product. I don't need to use as much product. And because I'm hyper diluting it, I'm able to cover a much bigger area with less filler. So what does that mean? When we hyper dilute the filler, I can inject these lines and maybe even these lines all with one syringe because we're using such small amounts of filler. And when we hyper dilute it, we don't get the welts because it just integrates into the skin. And you'll see the results immediately because it pops out the wrinkles immediately. And then the best part is with this technique, it actually helps to produce collagen, which means that the results will last longer because the filler integrates into the skin. Because it's so superficial, it's not going to migrate away. It's going to stay on the surface of the skin and it's going to continue to generate your own collagen. So it looks very natural. So it actually keeps getting better over time. You can get little tiny bruises from the little needles, but they're just little superficial bruises that go away in a couple of days as opposed to weeks possibly for deeper filler injections where you can get some major bruising. And we're avoiding the blood vessels. And we're so superficial that I can actually see the tip of the needle while I'm injecting. So I know that I'm not in a vessel so that we don't have to worry about the complications of fillers going into blood vessels. So these are the techniques that I like to use when I inject fillers. And I love using hyaluronic acid fillers for these type of treatments because the hyaluronic acid fillers are made from hyaluronic acid, which is a substance that's naturally present in your body. So hyaluronic acid is a gel, is a clear gel, and that's what lubricates your joints. That's what gives moisture to your skin. It's also the substance that's inside your eyeballs. That's hyaluronic acid. This is a natural substance that your body knows what to do with. And we have an enzyme that can dissolve it if you don't like the way it looks. And if it's injected in the way that I like to do, it could last for years as opposed to just a few months. The other thing that I'm really excited about doing is the autocore technique. And this is a technique that I came up with because we like to do regenerative medicine, which means we like to use your own body's healing powers, especially your body's ability to produce collagen and to regenerate fat. So when we combine fillers with PRP or PRF or the PRF gel, what we can do is we can use the filler as a scaffold. So we can use the hyperdilute technique and inject very dilute fillers superficially, and then we inject the PRP. So we take some blood and we extract the platelets from the blood along with some plasma, and your platelets contain growth factors. It contains hundreds of growth factors that send a signal for your body to produce more collagen, for your body to produce more fat. And this is how your body naturally heals and naturally regenerates. And we're basically sending that same signal for your body to regenerate. So it's a very natural way of making you look younger as if you were aging backwards. So when we combine it with fillers, we're using the fillers as a scaffold. So we don't have to put a lot. We just put a little bit of hyaluronic acid filler under the surface of the skin or on top of the bone. And then when we inject the PRP, PRF, or PRF gel, the platelets attach to the fillers and the fillers act as a scaffold. So it keeps them in place where we want that signal to be sent. We get a more precise generation of your own collagen, and we can stimulate your own fat pads so that we can get a very natural look, and it will last even longer. So this is our auto core technique, where we take some of the techniques that we've had really great success with, like the Y lift, like the vampire facelift, and the hyperdilute techniques. And by combining it with PRP, PRF, we are taking it to the next level because we're telling your body how and where to regenerate new collagen and fat so that you can look natural with long lasting results. And that's how we do it. That's our auto core treatment that we do at Omni Aesthetics. I'm Dr. William Song. Thank you for watching.